All right, we're talking with Ricky a bit this morning about his hip, and I think his case is really instructive because a lot of times it can be difficult to distinguish back pain from hip pain, and some patients have both, but they can be really difficult to sort out sometimes. And classically, when we think about pain that's coming from the back or from the lumbar spine, it tends to hurt more in the posterior aspect of the hip or the lower back. If nerves get pinched and are involved, it can radiate down the entire leg, even to the foot. You may have numbness or things like that. Pain from the hip, the ball and socket joint of the hip, is most often through the groin and will sometimes radiate down the front part of the thigh into the knee. And those are guidelines. Sometimes they overlap, sometimes people have a problem with both, and it can be sort of difficult to sort out. Now, in Ricky's case, you've had 5 back surgeries?
5 back surgeries.
Okay. And we're having a lot of pain in the hip area and some in the groin. And eventually what we did was a diagnostic test where we inject the hip with local anesthetic, with numbing medicine basically. And you got some relief with that.
I got the relief.
Okay. And so that pointed us back to the hip in your case. And you're now 2 weeks out from robotic hip replacement surgery on the right. Can you take a couple steps for us? And so getting around well.
I'm doing this
I think you are too.
because I couldn't do this before without pain being in there.
Okay. And so no walker or cane, no pain right now. Grab a seat with us. So sometimes difficult to hone in on what the actual problem is, so it's real important that you see the appropriate specialist, whether it be for your spine or for your hip, and determine what exactly is the source of pain. And in your case, robotic hip replacement was the answer. And
That was the answer. The good Lord and you answered it.
awesome.
Because I was in deep pain.
Well, I appreciate you sharing that because I think that's it's an issue for a lot of people. Is it my back? Is it my hip? It can sometimes be both. And so a lot of what we do is taking a history and an examination so we know we're working on the right thing. And then in your case, once we figure out what it is, we can fix it and
That's
get you a good result with it.
That's it. Because it's awesome. I mean, I actually thought it was my back and it was my hip.
Awesome. And you're happy you got it fixed?
I'm so tickled. I don't know what to do. I could jump over this bank here, I believe.
Awesome. Thanks for sharing that, man.
You're welcome.